The National Drug Law Enforcement Agency, NDLEA, says it has arrested about 17,747 drug offenders, including 10 high-profile drug barons in the last 17 months. The chief executive of the NDLEA, Brigadier General Mohamed Buba Marwa, retired while making this known to newsmen in Abuja, says about 2,369 were convicted, facing various jail terms, while another 11,000 drug users were referred for drug rehabilitation process. Marwa says the agency is working towards creating a call-in center for counseling and treatment in a bid to help drug users in need of counseling.
In 2021, that's last year, we counseled and rehabilitated about 8,000 drug users, in most cases through brief interventions. We continued the effort in the first 5 months of 2022, whereby an additional 3,523 were also counseled and treated in NDLEA facilities. Simultaneously, we have continued to shut the tap of illicit flow of drugs with the arrest of over 17,600 offenders, including 10 drug barons between January 2021 and May this year. We have convicted and jailed 2,369 within the same period, while 154,667 kg of drugs have been seized in the first 5 months of this year alone. Similarly, our drug demand reduction department, both in the headquarters and at state command, have been galvanized and working non-stop to ensure that the health aspect of the drug abuse calculus is getting adequate attention. We will be unveiling the NDLEA call center that will be manned by professionals and experts in counseling, psychotherapy, psychology, psychiatry, and more to offer help to drug users who will make use of our toll-free lines to seek counseling 24/7. This will also enable those afraid of stigmatization to be able to seek help without necessarily being seen or identified by anyone. The forthcoming sensitization training on DPTC for governance wives will no doubt bolster the effort to ensure that the consequences of drug abuse are nipped in the bud and prevented from snowballing into a public health problem that would overwhelm our society in the long run. This year's theme will go a long way in directing our attention to an area that requires collective effort to stave off future catastrophes.
Based on the 2017-2018 data, we estimate that today there might be close to 6 million persons in Nigeria that could be living with a drug use dependency. This creates a massive public health challenge. And therefore, our key policy asks on this World Drug Day to the federal and state governments, as well as to the international development partners, and I should maybe also include the candidates standing for political office, is not to lose sight of this public health crisis that is being caused by drug use. What is required to happen in the immediate future? First of all, we need to mount a credible and comprehensive drug prevention campaign, which focuses in particular on secondary schools, but of course, which doesn't leave out the large out-of-school population. We need to train teachers in 27,000 public and private secondary schools on the Unplugged methodology, which is a skill-based and evidence-based drug prevention program. This needs to happen now if we want to stem the tide of new young people becoming exposed to the issue of drug use and falling potentially into drug dependency. We also need to provide basic counseling services to everyone. This access for drug users and their families that will be provided through the call center that the chairman just mentioned is a critical step in the right direction in this regard. But we need also to provide more intensive quality drug treatment to the millions of drug users that live with a drug use disorder. At present, there's only about 18 full-fledged treatment facilities across the country. We need at least one per state, so 36 of them. We also need drug counseling drop-in centers that provide non-medical but counseling services to drug users across all local government areas. This is such a pervasive problem. This kind of medical assistance needs to be accessible at community level. And finally, we need to make sure that primary health providers and professionals in particular are equipped with basic drug treatment, counseling, and referral skills.